Patients with hyperthyroidism have several options to treat their disease, including subtotal thyroidectomy and radioactive ablations. When a patient is unwilling or unable to undergo these procedures, pharmacological therapy is often pursued. Other particular medication inhibits the conversion of iodide to iodine and inhibits the organification of iodine with tyrosine. Which of the following is an additional mechanism of the drug of action of this drug? So normally if the patient is unwillingly to go such surgical treatment or radiological therapy, okay, then we prescribe these patients with medications which inhibit or slow down the uptake of iodide, the conversion of iodide, and the formation of tyrosine, okay, and it inhibit somewhat the activity of the thyroid gland in case of hyperthyroidism. So we know certain medications which are used in case of hyperthyroidism, that is carbimazole, okay, carbimazole, and methimazole, carbimazole, methimazole, mazole like this, and propylthiouracil. And the propylthiouracil has two effects. The propylthiouracil is very and beneficial in pregnant ladies, because we prefer, if the patient is pregnant and having hyperthyroidism, we use medication that is propylthiouracil. Propylthiouracil. It's a bit difficult for me to write on laptop. Okay, propylthiouracil. So among all these medications, that carbimazole, methimazole, and propylthiouracil, one the drug that has two effects. Number first, it has an effect on the thyroid gland, and number second, it has an effect on the peripheral conversion of T4 to T3. So we can say that this propylthiouracil, it is and among all these enzymes, okay, all these medications, they inhibit the peroxidase enzyme, and the peroxidase enzyme present in the follicle cell of the thyroid gland, and they help in the conversion of iodide to iodine, and the organification of iodine with the tyrosine in order to formation of thyroglobulin, okay, and which are responsible for the formation of thyroid hormone. So in this case, what it do, the propylthiouracil, it inhibit the enzyme, so it inhibit the conversion of iodide to iodine into the follicle. It is not a peripheral activity, it is called a central activity of these anti-hyperthyroid medications. So it is the central activity. And what about the peripheral activity is that it inhibit the conversion of tyrosine T4 to triiodothyronine T3. So it is the only medication which has a peripheral activity of inhibition of the conversion of T4 to T3. Mostly these conversions occur in various tissues such as liver, kidney, and other tissues, okay, and it is a very important indicator for the development and metabolism. So let's see the answer. Permanently reducing thyroid activity, binding to and blocking the iodide transport mechanism of the thyroid follicle cell is the central activity. Binding to the intracellular nuclear receptor of the peripheral tissue and activating genes, no. Blocking the peripheral conversion of tyrosine to triiodothyronine, yes, this is a action of the medication which has a central activity of conversion of iodide to iodine and organification of iodine with tyrosine. So the medication is propylthiouracil. Thank you.